The default in medicine has always been man. Problem is, more than half the population are women. We have been understudied and misdiagnosed for too long. So Northwell created the only network of experts devoted to every aspect of women's health. When we raise the health of women, we raise everyone.
Good afternoon, everyone. Welcome to the relationship between heart disease and stroke. This program is brought to you by the Katz Institute for Women's Health in partnership with Northern Westchester Hospital, Center for Healthy Living, and Phelps Hospital. I'm your host for today, Amy Farrell-Martin, and I'm the Senior Community Outreach Program Manager at Phelps Hospital. And today we have our presenters with us. Welcome. We have Dr. Ramandeep Sani, who is the stroke attending at Northern Westchester Hospital and Phelps Hospital. She's also the Regional Director for Ambulatory Stroke Care, and she's the Stroke Director at Phelps, as well as the Director for Neurology. We also have Amy Rosenfeld. Welcome, Amy. Amy is a registered dietitian, Community Outreach Program Manager for Northern Westchester Hospital and the Center for Healthy Living. Welcome to you both. Thank you for joining us today. Today, Dr. Sani will be discussing the relationship between heart disease and stroke and provide education on the silent symptoms, treatments, and ways to help prevent risk factors. While that's going on, Amy will be cooking some delicious fish tacos while we chat, and she'll provide nutritional information for heart health. Some business before we get started. As time permits, we'll take questions throughout the program. Please put all of your questions in the chat or the Q&A function that you'll see at the bottom of your Zoom screen, and we'll be monitoring throughout the program. Also, throughout the presentation, to allow for more interaction with the audience, I'll be launching some Zoom polls as we go along with some trivia questions. You'll see a pop-up box on your screen with a question, and we ask you to give it your best guess, and our presenters after that will explain the answer. At the end of this program, we'll ask that you fill out a quick survey with information for more information on the Stroke Center and the Katz Institute for Women's Health. And now we'll get our program underway. So to start us off, Dr. Sani, what is a stroke and how does it relate to heart disease? Oh, Dr. Sani, I think you're on mute.
Sorry about that.
No worries, thank you.
The simplest way that I can describe the relationship is that, when a blood vessel is injured and you have impaired blood flow to the brain, that's when you lead to a stroke. Whereas if you have an impaired blood vessel that limits the blood flow to the heart, that's going to lead to heart disease. But the risk factors are the same, for both diseases that injure these blood vessels. And that's what we've realized. And we're trying to target these risk factors in sort of a preventative task force to improve the outcomes in both of these diseases.
And why is this so important for women?
Well, as we've seen care advance for heart disease as well as stroke, we certainly have seen improved delivery of care, but we've also realized that not everybody has equally benefited. Women in particular have been highlighted as a subgroup that may be at greater risk for heart disease as well as stroke. So in an effort to improve outcomes in women, we have the Go Red for Women movement, and this is our effort to educate women that they are at high risk, that these risk factors are prevalent in women, that they may not be targeted or treated as effectively as their male counterparts, and to educate them about atypical symptoms that they might experience and not be recognized as a patient having an acute heart event or stroke event.
Thank you for that. Now, Amy, as you'll be our food expert for the afternoon, we know in many households, women are the one who do most of the shopping to prepare the meals. What are some tips for food shopping and planning meals that us women can incorporate into our daily activities?
I'm happy to answer that. Let's launch a poll first.
Let's do the poll. We're going to launch a poll here. Audience, please take a guess at what you think is the correct answer here. Very interesting. I don't know.
Let's see if our audience does, and then I'll get to some tips.
Okay.
I tried to vote and I realized I'm
Yeah,
not.
it's not letting us.
We'll see if you get it right anyway, Dr. Sani. All right, so the majority of our viewers, what are they saying?
Right. Let's see.
I can share the answer if you want.
Yes, please share the answer with us.
All right, so the answer was B, fill your cart with a rainbow of fruits and vegetables. That is the healthiest way to shop. A lot of those things on there. Oh, okay, good. I see most people picked that answer. Excellent. You might have commonly heard in the past, like shop the perimeter of the store. You only should buy frozen fruits if to be healthy, or skip the frozen aisle. And those are all misnomers. Really, the key that you want to do, no matter how you do it, whether it's in the freezer section or the canned food section, buying low sodium fruits and vegetables, whatever you can do to fill your cart with a rainbow of fruits and vegetables, that's the most important. And for a lot of people, it's most affordable to do that in the freezer section or the canned food section. Some other tips that I always recommend to people are the 3 Ps: pick, plan, prep. And we don't plan to fail when we go to the grocery store. We just fail to plan sometimes. So grocery shopping and meal planning can be really overwhelming, especially if you're busy and your kids are in tow or it's all on you. So definitely making a list of some ideas that you want to before you go to the grocery store, checking your pantry before you go, creating a detailed list so it's as organized as possible. And whether or not you're doing this in person or ordering your groceries online, the more you organize and pick out recipes you want to make ahead of time to be have an efficient shop, the better you can do. A couple of other tips: you definitely want to fill your cart with as many things that are as close to ingredients you understand as possible. So reading food labels for recognizable ingredients, whole foods as much as possible, meaning foods that come out of the produce section or the meat section, the fish section, where it's a whole food that doesn't have a food label, and to really make the best choices for your family using all of that information.
Thank you for that. Now I'm already salivating knowing what you're cooking, but will you please share with the audience what you'll be cooking for us today as our heart healthy meal?
Yeah, sure. I wanted to make a recipe. Heart healthy, we also think is synonymous with fish. So we're going to be making a fish taco recipe that's paired with an avocado-based slaw and a tropical fruit salsa. It sounds overwhelming, but I promise it's a very, very easy recipe. It's a great recipe to make for the whole family, especially if you aren't the biggest fish family and you want to think of some easy ways to get your family to like fish or for yourself to like fish. This is a very good introductory option. It's really rich in unsaturated, heart healthy fats, especially ones called omega-3s, which makes it really good for stroke prevention. It's also rich in fiber from the fruit salsa, the cabbage, and healthy fats from the avocado. And it's full of flavor in a very heart healthy way: citrus, seasonings, and it's fast, very fast meal.
Wow, that sounds delicious. So Amy, I'm going to leave it to you to get started on those fish tacos. And I want to ask the audience another question here. True or false to the audience? Women have the same stroke symptoms as men. Here comes your next poll. Let's see what you think. Give everybody a second and then we'll pop up the response. All right, if everybody had a chance to, sorry, I see some of you said the poll didn't come up, but I'm hoping you were able to see it. And the audience has answered false to women having the same stroke symptoms as men. Dr. Sani, can you discuss the signs or silent symptoms of stroke and how they differ between men and women?
So I think we must have a very smart group of people here today, because they realize women, we are different. We're very different than men. And we certainly do have the more common stroke symptoms that men will experience that I'm sure you've heard of the mnemonic Be Fast, where you'll see a sudden change in your balance, vision, a facial droop, arm weakness. But because women have atypical symptoms, they aren't as recognized in our ERs and less likely to get the acute stroke treatment. The atypical symptoms that a woman might experience are like intractable hiccups, sudden onset of vomiting, generalized weakness, and they also will present with pain. None of these symptoms shall, I might be having some injury to my brain, but we have to raise awareness about this, that when we do see a female patient, that some of her stroke symptoms may not fit into the cookie cutter symptoms of BFAST.
Thank you for that. And what are the risk factors for stroke? Are they the same for men and women? Are they different? Is there a general set of risk factors we can help to prevent?
So that's it's a complicated question because certainly there are the common risk factors that affect men and women, such as high blood pressure, cholesterol, diabetes, lack of physical activity, smoking. It's just a matter of, we've seen disparities in how well these risk factors are controlled in men compared to women. And that's been highlighted in a number of trials, that blood pressure is not necessarily as aggressively treated in women. Either is cholesterol. Women, not only are we, mothers and caregivers, we're breadwinners as well. I mean, we make the household work, so we don't naturally get out there to get our time for ourselves and do the physical activity that we need. So certainly, those are factors, but in younger women, certainly pregnancy is a high risk period. And the importance of prenatal care to highlight that you need to get your blood pressure checked when you're pregnant. You need to monitor your sugars, because if you do develop high blood pressure or diabetes during your pregnancy, that can certainly impact and increase your risk of stroke. Certainly once we get into the prime of our life and we start phasing into menopause, our risk of stroke starts to increase because some of these traditional risk factors are far more common as we transition into the prime of our life.
Thank you for that. Amy, how is it going in the kitchen? I have a question for you based on what you said the last time. A question: do canned fruits and veggies have the same nutritional content as fresh fruits and veggies?
So it's a really good question. So I would say it also depends on when you're picking your fresh, because this time of year, this program, we're in the Northeast, fruits and vegetables are traveling really far to get to us right now. So fruits and vegetables, the longer they take to travel to us, the less their nutrient value is. Because once you pick a fruit or vegetable from its source, the nutrients begin to die. So I'd say right now in the Northeast, it's better to pick frozen or low sodium canned options because they're picked and preserved with all of their nutrition. If it were summertime here in the Northeast, I'd say go to your farmer's market and get it right there from the source, because it's going to be higher in nutrients there. So it's a variable question there, a tricky one to answer, but it kind of depends on where you live and the time of year.
Interesting. And a question came from the audience as well about the bones in fish.
Yeah, I saw that.
A fish that's particularly less bony? How can we prevent that? Any tips on that?
Yes, that's a really good question. This recipe, I'm going to show you how we kind of account for that a little bit. I'll show you how it's prepared. But definitely, get to know your local fish merchant, especially if you go to the grocery store and you buy it fresh from the fish counter, and say, I have young children at home, or I'm particularly concerned about bones. Can you do a little extra check on my fillets and really make sure that they're really doing a good job at your deboning? This particular recipe, and I'm going to tilt my screen down, Amy, so everybody can see exactly what I'm doing. This particular recipe here, I seared the fish, and after I seared the fish, to put it into the tacos, I cut it up into pieces, and we're going to layer it. I'm going to show you how we're going to layer it. So I'm able, especially for when I make this for my children, I myself have young children as well, I'm able to check it a little more carefully. So for myself or for members of my family, I'm able to look at that. And this fish is a cod. It's a very neutral fish, so it's very well accepted. I seared it. I put a little bit of fresh lime juice on top. And then I put a seasoning that I mixed together myself. In here is a little bit of chili powder, just a little bit. You can vary that depending how spicy you like things. Some garlic powder, some onion powder, excuse me, some salt, ground cumin, and I kind of rubbed it all over the fish with the lime juice, and then I seared it in a pan with a little bit of olive oil for 3 minutes on each side. And then I'm going to show everybody how we're going to do the slaw. And if there are more questions, Amy, you can let me know as I'm mixing things together.
I do have another one for you. A question about mercury or other hazards in fish. Is it possible to eat too much fish, not enough fish? Are we worried about mercury with certain fish?
Yeah, that's a really good question. So when it comes to mercury, there's a really good guide from the Monterey Bay Aquarium. If you go on their website, it's a free downloadable guide by your region in each of the locations in the United States. And you can see exactly what mercury levels are in fish at the time because it varies. But in general, rule of thumb, the smaller the fish, the less mercury it has. Because when a big fish, like say a tuna, eats other little fish, it's getting more mercury in its system. So you want to choose smaller fish. You want to choose things based on the guide that's recommended by the Monterey Bay Aquarium. Say like a tuna is going to be very high in mercury, but a herring, for example, would be very low in mercury as an example. But the cod I chose today was a more locally sourced, low mercury option. So I'm going to show you first the salsa. I took some mango that I chopped up very finely into about an inch size piece. And then I took some pineapple and did the same. This is so rich in vitamin A, for some vitamin C. I've got some chopped tomatoes here, and I use cherry tomatoes. You can use whatever tomatoes you have in the house. Going to mix that together with some diced red onion. And then some fresh cilantro. If you're one of those people that when you eat cilantro, it tastes like soap, you can either skip the cilantro or you can substitute parsley. That's another good option. Or leave it out completely if you want to. So this is just gonna all mix together and marinate a little bit. And this can either be an accompaniment to your fish tacos or to have it on top.
Looks
and then
delicious.
You wish you were in the kitchen with me, right?
I do. Send some my way.
Then we're gonna do the slaw. So the slaw is a healthier version of your typical slaw. Your typical slaw that you would have on, say, like a traditional fried fish taco is made with sour cream, which is fine in small amounts, but I wanted to make one that was a little heart healthier using avocado. It's a very good substitution. It's going to give us that same creamy mouthfeel that we want without adding extra saturated fats. So I'm going to take my avocado here and I'm going to scoop it out into my bowl and I'm going to mash it up, and it's going to help me. Where's my fork? There we go. It's going to help me to create like a creamy like texture in my slaw. And you want to definitely use a ripe avocado so it's really easy to blend. And then I just purchased a coleslaw package here without any dressing. You could also use broccoli slaw. I've done it with that too if you really want to get some extra nutrition in. I'll show you how fast I wish you were timing me, Amy. You can really see how fast all of this is. All right, so I've got my avocado in there. I'm gonna put some more cilantro in. And again, you can leave it out or substitute. Put some locally sourced honey. This is gonna help give it a little bit more stick, balance out the sweet and the savory. It is still sugar, so I'm just using a tiny little bit. And I'm using locally sourced to get the benefits of helping with seasonal allergies, which, believe it or not, I think are starting in New York already. I'm going to take some fresh lime juice. I'm going to squeeze the limes. And if you ever have trouble with your limes, like getting the juices out, you can either pop them in the microwave or roll them, which is also really good for stress relief, actually.
I did not know that about the microwave. Wow.
Yep. just for a couple seconds to get the juices flowing, or just squeeze them. And then I'm going to add some fresh lime zest, a little extra zest there.
Is there an alternative to the mango, Amy, that you could use to get the same flavor?
So if you wanted to leave it out completely, you could and just use pineapple, or you could use a totally different tropical fruit. You could use papaya, oranges, whatever you like, really. I just pick mango because I know my family really likes mango, but you could use whatever tropical fruits work for you.
Okay.
And this is going to kind of just sit and marinate while we keep talking, and I'll show you how to assemble everything later.
Wow. So I'm hungry. I don't know if anybody else is, but I'm definitely hungry. And as a mom, I'm busy. I'm very busy, as I know you are too, Amy. What
Yes.
are some tips busy moms can use to introduce heart healthy foods into their family's diets?
Yeah, so it's a really, really good question. I have young kids also, so I completely understand, and I work full time, and it can be really challenging. I think what my best advice in the way I write recipes is for you to really take your family's favorites that they already accept and tweak them to be healthier, rather than say, okay, we're gonna all, have quinoa bowls now. Okay, I think quinoa is delicious, but if you just pop that in front of your family, they might say, what is this? Like, let's not have this tonight. So really taking what your family already has and making small tweaks. So if your family's a white rice family, maybe you slowly start to mix the white rice and the brown rice together to integrate in whole grains. Maybe you air fry your chicken instead of pan frying it or deep frying it. And still have it with all their same favorites. Maybe you substitute ground turkey instead of ground beef for your chili recipe next time. No one will know the difference, I swear. And just slowly start to make these little tiny changes, integrating into your family, and reward when they do try things, even the partners in your life. Reward them for when they try new things and get on the same page, and model the behavior for them. If you're expecting them to do it, you say you're worried about your husband or your partner or someone in your life, and you yourself are not willing to make the change, it's not going to be as good of a sell. So if everybody gets on board and tries to do it together and works towards the goal that they feel comfortable with in very small ways, very small changes, it can really go a long way.
Thank you. And speaking of small changes, is there a difference between wild caught fish and farm raised fish? Should we be looking for one or the other when feeding our families and shopping?
Yeah, so that's a really good question. That's why I really recommend the Monterey Bay Aquarium's guide, because it depends on the fish. Some it's healthier to have farm raised, and some it's better to have wild caught. And also it can vary month to month, season to season, depending on how the animals are doing. So it's good to stay on top of it. It can be confusing and frustrating, but it depends is the answer.
Okay, thank you. So I want to ask both of you some questions and hear both perspectives, coming from the dietitian, coming from the clinician, not that you're not a clinician, Amy, but coming from Dr. Sani. What are some other simple lifestyle changes that can help reduce the risk of stroke? I know we're talking a lot about diet, but exercise, lifestyle, stress reduction. Dr. Sani, can you speak to that first?
So I'll tell you, for me, I will tell you that it's really hard at the end of the day to force myself to go get some exercise. It really is. So what I do is I preemptively will tell my kids that we're going to do something together after work. And no matter how tired I am, I can't say no to them, And so just the other day, I told my son, I'm like, we'll go play basketball together after work. And honestly, I was really tired. I was hoping that he wouldn't remember, but they always remember, and so kind of having another person hold you accountable, having a partner that you're making a plan for, and making it more of a social event rather than, oh yes, I'm just going to get on the treadmill by myself and do it by myself. Try to plan it with someone else, and it makes you hold yourself more accountable.
Thank you. Amy, what are your thoughts on that?
Yeah, I definitely agree with all of that for sure. And I would add also in terms of um, being active, it isn't just about intentional exercise, but it's also just being more active throughout the day. So standing instead of sitting, they say that standing is the new smoking, and it can be really detrimental to your health. So taking walking, phone calls, having a standing desk. I started using one and I really, really feel so much more energetic at the end of the day. Taking short breaks just to incorporate little walks in. It doesn't have to be this hour-long intentional exercise. Just to get more movements in, having a step counter, having a step competition between you and your partner, that can be really helpful. And then to your point about stress, I would say it's stress and sleep, because most of us are not getting enough sleep. And Dr. Sani, I'm sure you could speak to a lot about the correlation between heart health and sleep. But I see a lot of people who are just not getting enough sleep, and we're seeing new and new discoveries about how it's connected to your health and impairing your health. And of course, stress is related to that, right? So anything you can do to incorporate moments of calm into your day, starting a meditation practice, a gratitude practice. Stress levels are off the charts right now. I myself try to do grounding exercises while I'm cooking to really, play up grounding sensory exercises while I'm rolling meatballs, or just the simplest task, even if it's just for a couple of minutes, it really helps me to incorporate that into my day.
Thank you. And Dr. Sani, is there a large link between stress and high blood pressure?
Certainly stress plays a role, and we don't realize how we internalize it, but certainly stress does play a role. And I think, as we've seen that society works, we are doing more and more, and there's a lot of things that are out of our control. We don't realize how we internalize it and it affects us. But I would echo what Amy says, that taking that time to kind of focus and reassess, what do you want to accomplish? What are things that are within your range of control? Center yourself during the day, and focus on more of the positive things and the impact that you can have. I think that's a really key thing that I try to do for myself. Also teach my children at an early age, because it's not all about go, go, go. Your body does need to rest. Your body does need that time. There's important things that happen when we slow down, when we sleep. Those are all necessary for a healthy living as well.
Thank you. So now that we've discussed some of the symptoms and risk factors of stroke, what are the different types of stroke, Dr. Sani? I have another poll for you guys. I want to see if you guys are aware that there are time-sensitive treatments for acute ischemic stroke, and see what you guys, if you're knowledgeable on this or not. And Dr. Sani will explain it to us. So take a look at that poll. And then we'll pop up our answer and let Dr. Sani educate us. All right, if everyone had a second to see that poll, let's see what everyone said. All right. Dr. Sani, can you address that for us?
All right, so there are two major subtypes of stroke. And as the question said, acute ischemic stroke is the most common type. It accounts for 87% of all stroke that we see in this country. And for that stroke subtype, there are time-sensitive treatments. So if you experience stroke symptoms, there's no way to know clinically, are you having an ischemic or a hemorrhagic stroke? You need to get to the hospital readily for emergent imaging. And that's why we have stroke centers with time targets set. As soon as you activate a stroke code, our goal is to get you in the CAT scanner as fast as possible. So we know, are we dealing with an ischemic stroke or a hemorrhagic stroke? If it's an ischemic stroke, if you present within 4.5 hours of symptom onset or last known well, you're eligible for an IV drug that could dissolve the clot. Now, depending on how big the clot is and if it has occluded a larger artery, in addition to that, we could mechanically try to remove that clot as well. Now, conversely, if you were to have a hemorrhagic stroke, this is due to bleeding into the brain. Emergent care is also needed there because you might need emergent blood pressure lowering, or if you happen to be on blood thinners, as many of our older patients are, you need rapid reversal of that blood thinner so the bleeding doesn't continue to ensue.
Thank you for that. And what are the types of stroke centers Northwell has in the area? So
in the Westchester area, we have primary thrombectomy capable, and then our comprehensive stroke center is at Lenox Hill in Manhattan. Now, it's important to know the different types of stroke center in your area. You should know that every stroke center is capable of giving you the IV thrombolytic clot dissolving drug. All of them are. Okay, but the mechanical thrombectomy, which is needed to remove larger clots out of the larger arteries, that can only be done at a thrombectomy capable center, such as Phelps, and at Lenox Hill, which is a comprehensive stroke center. But the primary stroke centers, there's far many more primary stroke centers in your area, and their role is really critical because they identify these patients so fast, they administer the clot busting drug, and then they make sure they transfer you to a higher level of care if you need to be transferred. Northern Westchester is our primary stroke center, and they transfer most of the mechanical thrombectomies that are done at Phelps from Northern Westchester. So I think as a team, we deliver the best care. And we don't just highlight delivering treatment at that main hospital, but how fast do I get that patient to the next hospital to get the next level of care?
Thank you for that. It's good to know we have one here in Westchester and throughout the Northwell system. Now, what's the recovery process like for a stroke? Is there anything specific we should know how to prevent a secondary stroke? Any separate risk factors or prevention guidelines?
And so, I mean, my role as the regional director for ambulatory stroke care really emphasizes the importance that stroke care just doesn't stop once you're inpatient. It has to extend to outpatient because that's when our stroke patients need us the most. The recovery process is slow. You know, it can take over a year for you to really see the complete resolution of symptoms from your stroke. The fastest pace of recovery is in the first 6 months. But there's many things with our patient that we're still trying to do. We're trying to make sure their risk factors are adequately controlled. We're trying to make sure that if there's any additional workup to identify the underlying cause for stroke has been identified and addressed. Not to mention depression is quite common in our stroke patients. I mean, it is a life-changing event, not just for the patient, but the whole family. So you end up being the counselor and giving them that emotional support they need when it's such a trivial time for the whole family, and highlighting that this is quite common and we can treat this and we can support you and get you to the next phase.
So time is of the essence when getting to the emergency room with any stroke symptoms, but on the other side, if it is a stroke, recovery is about patience, is what I'm getting.
Definitely.
Thank you for that. Thank you, Dr. Sani. Now let's check in with our tacos. I know we're probably all eager to see the Amy eat one, maybe, so you can all feel like we're part of it. How are we doing over there? Amy?
Yeah, we can get to that for sure. So I'll tilt my screen down. I can see I plated it up for everybody so they can see. Ooh, yeah. So you have here the salsa that you can serve on the side. I would just eat it with a spoon, but you could also dip it with a couple of baked tortilla chips. A little mini bell pepper would also be nice. You could scoop it with that. And then I have here the tacos. You can see it was similar to what I was talking about before. A traditional fish taco in a lot of places are fried. So I just took what normally would be there and just tweaked it a little bit. So it's a grilled pan-seared fish on the bottom. And then the slaw, I just tweaked ever so slightly. So instead of using a sour cream, using an avocado base, and really light, fresh on a corn tortilla that I just woke up a little bit, pan-seared it. And this is a great lunch. You could have one, you could have two, depends how hungry you are. But I would say all in all, this dinner or lunch, whatever, it probably will be my lunch, took about 20 minutes, maybe.
Delicious, absolutely delicious. Now, I want to ask the audience something before I ask you our next question. let's see if our group knows some ways to make your cooking more heart healthy.
Yes, let's see. I tried to make it a little trickier because I knew this audience would be well versed. I had a feeling. So let's see.
Let's see. Everybody take a second to answer this poll. Oh, we have A and C. There's multiple options.
Yes, so it could be bulk up your cooking with fruits and vegetables wherever you can. Substitute butter for coconut oil. Season foods without salt using fresh herbs, spices, stocks, and vinegars and citrus. All of the above, or A and C only.
Let's see what we got, everybody. What is our...
Okay, so it looks like the majority of the audience, I couldn't even get them on this one. They got it right. It's A and C only. Exactly. If the answer was only bulk up your cooking with fruits and vegetables wherever you can, and season your foods without salt, fresh herbs, spices, stocks, vinegars, and citrus. Coconut oil is actually not heart healthy, and there's a lot of misconceptions surrounding that. It is a plant-based oil, but is a high saturated fat oil. So especially if you're at high risk for stroke or any cardiovascular event, you do not want to be using a ton of coconut oil and instead use unsaturated fat-based oils like olive oils, vegetable oils, avocado oils, nut oils, etc. Yeah, and then I would say it's good, in small amounts. It has its purpose, to substitute for butter in baking, or if you're making a certain, cuisine that requires that coconut flavor. But in general, you really want to stay away from that, no matter what social media says. And just some other tips, I would say, definitely wherever you can, you want to substitute for those healthier fats. So removing the butter as much as you can and mayo, and substituting, say, avocado in, or nut and seed butters where you can. Trying to have healthier methods of cooking, like air frying, grilling, braising, caramelizing, roasting, baking, staying away from the frying, and really a big emphasis on plant-based. You want to really make sure that you are at least being what we call plant forward, which is the majority of the foods you eat are coming from a plant. Thinking of meats and animal products as more like a side dish rather than the main event, and trying to eat as many plant-based meals as you can, as well as reducing the amount of salt and sugar in your diet as much as you possibly can with different culinary ways. I see there's a question.
Yes. Does that apply to coconut lotion and coconut hair oil?
That's an interesting question. I haven't seen a lot of research in understanding how our bodies absorb it through our skin and our hair to affect our risk for heart disease and stroke. Dr. Sani, have you seen any good research on that? Because I haven't.
I haven't seen any connection between topical application and actually increased stroke risk or heart disease.
Okay. I haven't either, but I couldn't say definitively yes or no. But it's definitely good to think about. I myself will be looking that up for sure. But yeah, were there any other questions? I didn't see any right now, but
I think there's one thing from the audience that I just want to address that came earlier. Is there any relationship between extensive superficial phlebitis in one leg and stroke? So the question is, the real answer is what's the cause for the phlebitis? Certainly developing a clot in a superficial vein, that doesn't pose a risk for stroke. And most of the veins, the clots are trapped on the venous side unless you have an abnormal connection in your heart, right? But we really worry about venous clots if they're in the deeper veins. But if the superficial phlebitis is due to an inflammatory effect, an underlying inflammatory effect, if you're prone to getting inflammation in your blood vessels, there could be a link. So it depends on the clinical situation.
Thank you. And another one just came for you, Dr. Sani. What are symptoms of stroke and how to further lower your risks? I know we talked about that a little more, but.
So the common symptoms of stroke are a sudden change in inability to balance yourself, walk straight, a sudden change in your vision, sudden inability to talk clearly or express yourself. If you see a facial droop, If you see that one side of your body seems to be heavier and you cannot elevate your arm or leg. The other thing is I want a sudden onset of a severe headache, and it should be severe at onset out of nowhere. That is a sign of, that could be a sign of a stroke as well. Also, new types of headaches. If you're not someone who's had migraine and suddenly feel like you're experiencing the worst headache of your life, you should question why. Okay. Those are the typical signs and symptoms. And of course, the atypical symptoms that I already mentioned in women, where it's hiccups, intractable hiccups, unexplained repetitive vomiting, generalized weakness, and pain, unexplained pain. So in terms of how to minimize your risk, it's really about knowing yourself, knowing your family history, making sure you go for regular follow-ups and identify, and with your doctor, identify what are your risk factors for stroke. Do you have high blood pressure? And it's not enough to just have your blood pressure checked in your doctor's office. You should be checking it at home as well to assure that it's well controlled. Do you have high cholesterol? Do you have diabetes? And it's not enough to just take the medication that your doctor gave you. Well, what's my target? What's my goal with this medication? How are we monitoring that I'm well controlled? And I think we're trying to change away from this dynamic where it's just coming to the doctor every 6 months or 1 year. We want to have a proactive relationship with our patients and make sure they're well engaged and know what their goals are.
Thank you, Dr. Sani. And Amy, another question for you. What other easy, heart healthy, or recipe ideas would you recommend? Similar to the fish tacos that you said only took 20 minutes. I think we all really like the sound of that. So anything else along those lines you could suggest to us?
Yeah, so I like to suggest maybe like a little bit of outside of the box thinking, especially because I love promoting plant-based eating. So it's still cold-ish, and some really easy stuff that you can throw into your slow cooker and let cook all day are soups, stews, and chilies. You can make them vegetarian or not. And I think that's a really, really great one. I also recommend to people a lot of, thinking about favorite things. People love tacos. There are lots of different versions of turkey tacos and turkey burritos or rice and beans, things like that you could have very, very simply. Stir fries are really fast as well. Last night for my sons, I made a tofu stir fry. I air fried the tofu, sauteed it with a bag of frozen broccoli, and put it over brown rice, and dinner was done in 20 minutes also. So that's a really easy one. I love eggs. I love promoting eggs. There's a really big misconception here that eggs are not heart healthy, but they actually are in small amounts, maybe like 5 or 6 per week. It's the cheese and the bacon and all that kind of stuff that we put with the eggs or on top of the eggs that isn't so healthy. So making a vegetable omelet with some whole grain toast is super fast, or a frittata. You can make them in little muffin cups for sure to have a fast, easy meal, serve it with a salad. So lots of great ideas. And the Center for Healthy Living, I can drop it in the chat. We have a lot of videos and people can watch some other cooking demonstrations for some more ideas if that's helpful.
Awesome. And someone else just asked, they're trying to stay away from carbs. How can they increase their protein intake?
Yeah, so I'll say 2 things about that. The first is we need carbs. Your brain can't function without carbs. Your eyes can't function without carbs, and your muscles can't function without carbs. So carbs are kind of this like buzzy word that people like to say, but fruit is a healthy carb. Vegetables are a healthy carb. Sweet potatoes are a healthy carb. Whole grains, beans, like these are all things that are really, really important for us. And I would say as Americans, most of us are getting enough protein. So really what I would always recommend people adjusting in their diet is what types of carbs they're choosing, rather than say, I'm going to go no carbs. Research shows that there's a lot of bounce back if it's for a weight loss reason or anything like that, or even blood sugar control. You don't want to have no carbs. You want to choose the right carbs and have them in the right portions. So a quarter of your plate being protein, about the size of the palm of your hand, and the rest of it being filled with healthy fruits and vegetables and very small amounts of starches.
Great. We're getting a lot of questions here, Amy, so I'm going to stick with you for a second. How does gut health relate to stroke? Does it relate to stroke?
So there's a lot of new research coming out about gut health. It's like one of these new, and Dr. Sani could probably answer this question a little bit as well, but there's a lot of new research coming out about it, a lot of which we don't know definitively at this time. But in general, promotion of gut health, again, healthy carbs, fibers, probiotics, things like that are very important in general for overall health, and research over time will let us see the direct correlation. I don't know, Dr. Sani, if you want to add to that.
Certainly. I mean, I think there's a lot of interest in looking into this research about that the gut is actually our first line of defense for immunity. And if what we're eating is leading to inflammation, and is that inflammation systemic, and does it affect other blood vessels, other organs within our body? But it's relatively new. It's certainly quite interesting, some of the data that we're getting out there. And certainly we are looking at anti-inflammatory markers as the next phase of what other preventative agents can we offer to our vascular patients. So that is a new area of research that is in development.
Thank you both for those answers. I'm going to go back to you, Amy, for a sec. Do you have a favorite website for heart healthy recipes?
So the American Heart Association actually has a lot of really good recipes on there, as well as the American Stroke Association, which is part of the American Heart Association. So I would start by looking there, because there are some really, really great ideas and a lot of good cooking tools. Yeah. So I would start there.
Okay. Thank you. I can attest to that. They have some delicious muffins that I've made off their website.
Yeah.
Is extra virgin olive oil good to lower cholesterol? And if so, how much should you have a day?
So extra virgin olive oil is a great heart healthy fat choice. It's a monounsaturated fat. It's what I made with the recipes today. Definitely good choice. I would say, in general, you want to think about limiting the quantity, because anything that's a fat choice, like olive oil, avocado, nuts, seeds, the portion sizes should be very small, because they're very high in calories. So even too much of a good thing can not be a good thing anymore. So when you think about it in terms of when you're cooking or salad dressings or things, portion sizes. So cooking with 1 to 2 teaspoons of olive oil versus just dumping it in, limiting your salad dressing to say a tablespoon at a time, and using an olive oil based salad dressing. But you don't need to count how much you have throughout the course of the day. It's when you're eating to keep your portions small.
Thank you. Thank you, Amy. Now, Dr. Sani, I have some questions for you. The first question that came through the chat is, what elements of a patient's plan should alarm providers that they could be having a stroke?
I think pain, right? They're asking about pain.
Oh, is it pain?
Pain.
Oh, what elements of a patient's pain? Sorry.
Yeah, sure. Certainly head and neck pain. If they're having new pain around their eye, centered around their jaw, the back of their head, that could signify some vessel injury. And also, of course, I've already emphasized a sudden onset of severe headache out of nowhere, where the intensity is at its maximum right at its onset. Those are symptoms that sometimes get overlooked as this might be a stroke.
Thank you. Thank you. And does long COVID affect our heart? And if so, how?
I think it's too early to tell. I mean, certainly where the long-term effects of this virus is of interest. And we're certainly seeing, some patients that are still struggling, but I think we have yet to see, there's new research that's coming out every few months about this. And I think it's going to take us some time to reach some conclusive evidence about what is the impact of this virus.
Should a patient who had COVID or who has long COVID, should they be meeting with a cardiologist, neurologist, just to have their heart monitored?
Not unless they've had, if they have persistent fatigue, persistent shortness of breath, they've had preliminary tests showing there's an impairment, in their cardiac function, or they're having symptoms where their memory has been affected and slowing in their thought process, persistent headaches. It's all about, we know that many of these symptoms might occur early on but it's a virus and they should eventually clear out. But if you're having them, several weeks or months out from your initial infection, then certainly you might want to seek further care.
Thank you. And I have another question here. I think we can maybe generalize it and just say, is there a difference in stroke symptoms and treatment for different racial or ethnic groups?
No, there shouldn't be. And that's the whole point of, programs such as this, that we're trying to eliminate this disparity in care, and we recognize there's a disparity in care because life's just not fair and not equal. And this is our effort to try to even out that playing field.
Thank you. We have a couple more minutes for any more questions. I do see someone saying, will there be a replay of this event? And yes, the event will be recorded and we can email you a copy of the event, and it will also live on our CATS website. But if anybody else has any other questions, we have another minute or two to answer anything. I really appreciate all the engagement and the participation from the group. It's been a pleasure conversing with all of you.
I'll just add one more point to what Dr. Sani was saying in regards to, really that there shouldn't be this disparity. And it's the same with healthy eating. I think that there's a lot of push towards people saying you need to eat a certain way or only eat certain foods or follow a certain diet. But we all have certain ethnic preferences and cultural backgrounds, and we should be celebrating those recipes for our own cultures. And there's a way to eat in a heart healthy way that fits with everybody's culture and still enjoy your favorite foods and still enjoy things that are valuable to you and your family and your backgrounds. So I just like to make that point as well.
Thank you, Amy. Thank you. I want to thank everyone for joining us today. Lisa's going to share we're going to share a contact slide with contact info if you want to reach out to us, hear more from Amy, hear more from Dr. Sani. And if you're interested in learning more about women's health at every age and stage, please visit the CATS Institute for Women's Health website and sign up for our monthly newsletter. You'll see this presentation. You'll see very similar presentations to this one as well. There's just a wealth of information on that website. So I encourage everyone to check it out. And we are going to pull up a brief survey that'll pop up on your screen immediately following this webinar. Your feedback is very important to us. And on the survey, if you'd like to be contacted for more information or schedule an appointment with the Stroke Center, please share your name and your phone number and our providers will contact you. And additionally, if you have any questions that was not addressed during the live presentation, please put your name, contact info, and your question in the designated field, and someone will get back to you. And again, thank you all so much. Thank you to our presenters and all of you for joining us. I hope all of you try this fish taco recipe. I know I'm going to be, and Amy, I'll be letting you know how it is. And thank you all for joining us today. There's a couple questions. I don't know if you want to just get to this. Dr. Sani, can pulsatile, I'm not saying this right, tetanus be caused by a blood vessel?
Yes, it can. Yes, it can. And actually, usually when I see my patients and they complain of tinnitus, which is basically hearing some abnormal sound, the question I always ask is it regular, to determine, is it pulsatile, right? And having pulsatile tinnitus enough is not, it has to be paired with stroke symptoms, because we have to remember that our carotid artery is right behind our ear. So it's not uncommon when you put your head down to your pillow that you could hear your artery pulsating, So it's got to be pulsatile tinnitus with some new symptoms suggestive of stroke.
Great. Thank you. I see some people are sending their emails. Please, if you have more questions, fill out the survey for us, leave your email, write your questions, and someone from our clinical team will get back to you. And if you have any interest in seeing Dr. Sani or making an appointment at any one of our stroke centers, you can leave your information there and we will also follow up with you through that. So I see all of you seem to really enjoy the program. We thank you for all the wonderful feedback. Leave us some more feedback on that survey. And I wish all of you a great afternoon, unless anybody has any other questions.
I'll just see that the survey is going to pop up on your screen right after people are asking. It pops up right at the end.
Yep, as soon as you hit end or leave. All right, well, thank you guys. And if I see whoever's leaving their emails, try and if you can leave your email in the survey for us to get on our mailing list or for more questions. It's easier for us to track that way. Thank you all.
you.
Have a wonderful afternoon.